You'll hear online where you can do a flashlight test and try to hold a flashlight up to your scrotum,
6.
Can't be, that's inside the room.
see if there's any dark spots. I mean, really, the best thing to do is just get into the physician. There could be any number of things going on in the scrotum.
You're not reading it right. 5 meters, man. 4. What the hell?
Good morning, good afternoon, good evening, wherever you may be. In my case, it would be afternoon. And welcome to Fireside Chat number 62, where I will be talking testicles with Mike, founder of the Testicular Cancer Society. And, well, he does other things as well. Mike, thank you for coming on the show. How are you doing?
Great, great. How are you this afternoon?
I'm doing well. I'm doing well. I have a appointment with the medical team on Wednesday. They're going to essentially tell me the results of the analysis of the offending party 2 weeks ago, and I guess from there we will discuss treatment. So I figured, considering what's been going on lately, the testicular cancer topic should be discussed in a broader context outside of myself. It is, well, let me ask you a question. Is testicular cancer a cancer that is specific to men, just to clarify?
Yes, I suppose that would be the case, yes.
Unless, you're the type that says, hey, not all men, not only men have testicles. So, well, let's learn a little bit about this cancer. If we could talk a bit about it, so people some info. What is testicular cancer in the simplest way?
I mean, basically, it's an overproliferation of cells in the testicle that, basically unregulated keeps multiplying to create, tumors that are abnormal tissue.
All right. And as far as cancers go, how common is testicular cancer?
So it's a leading cause of cancer in young men aged 15 to 35, but it actually occurs at any age. So we've seen, 6 months olds and 80-year-olds with testicular cancer. But overall in the U.S., it affects about 9,000 guys a year, and about 1 in 250 or so have a risk of getting it at some point in their lifetime. Testicular cancer is about 1% of all male cancers, so it's not a huge number. If you look at prostate cancer, off the top of my head, I don't know exactly the number, but it's upwards of like 220,000 guys a year. And we think of prostate cancer really as a cancer that doesn't kill, yet there's about 27,000 guys a year that die from it. So there's actually 3 times as many guys dying from prostate cancer as there are all guys diagnosed with testicular cancer. Kind of put it into perspective.
How would they check?
I mean, there really is no good way to check. I mean, you'll hear online where you can do a flashlight test and try to hold a flashlight up to your scrotum and see if there's any dark spots. I mean, really, the best thing to do is just get into the physician. There could be any number of things going on in the scrotum. Not all of them are testicular cancer. And really, the only way to know for sure is a physical exam and then hopefully a scrotal ultrasound. It's a non-invasive test, uses no radiation, and it's fairly cheap to do. So really, that'll give you, if anything else, peace of mind, because a lot of times it's that uncertainty that can be the most difficult to deal with.
Essentially, I was misdiagnosed the first time, and I wonder, is that, I guess, all my story, so you know what my experience was, but I also would ask, do you think that it's common to make that mistake, maybe because it was early on, or what have you, or you think this was maybe I don't know if you would call it a whatever on the part of the hospital? Do you know what? Can you speak to that?
Well, I mean, so I guess there's 2 things. One, we always, as guys, seem to try to justify reasons. It was because I sat for 8 hours on the plane, or because I rode a bicycle, or when we have pains in our scrotum. And really, that kind of is a bad situation. Obviously, if there was a situation like torsion, it's essentially the testicle twists and the blood supply cuts itself off. And so it really is an emergency where if it's not corrected almost immediately, you risk losing the testicle just because of dead tissue. As far as the diagnosis process, There is epididymitis that can happen with the tube that leads to the testicle. And a lot of times, or sometimes, I guess, if there's swelling, it's difficult to be able to tell exactly what's going on in the testicle. You know, one of the other issues that I think a lot of guys face is that they hear, oh, it's an infection, here's some antibiotics, and all of a sudden 2 months later they're sitting there, and while their symptoms aren't really much better, they think, oh, it was just an infection, it's not getting worse, you know, eventually these symptoms will go away. And I think the key there is that doctors really need to educate that, hey, listen, we're sending you home, but if you're not better in 2 weeks on these antibiotics, then you need to come back in and we can either redo the ultrasound or try something else. But really, it shouldn't go for an extended period of time with having symptoms without really a definitive cause of it.
I'm going to be getting the results that I guess not only determine what we're looking at in terms of, you know, treatment, but I assume that the only way you can get to that point is if there were different kinds of testicular cancer. There's like I think that from what I read, there's like a fast one and there's a slow one, but there might be more to it than that. Can you talk a bit about that?
Yeah, so the vast majority of testicular cancers are developed from what are called germ cells. And it's basically the cells that essentially make sperm and everything else. So the two main types of germ cell tumors are seminoma or non-seminoma. Non-seminoma itself has 4 different tissue types in there as well. Typically, the seminomas do seem to grow a little bit slower and are sensitive to radiation therapy as well as chemotherapy, where non-seminomas really tend to be more aggressive and also are not radiosensitive. So they do differ a little bit. There are other types as well. You can actually have a primary testicular lymphoma and other things. You can have sex cord tumors, but those are kind of more on the smaller spectrum. And the vast majority are going to be either seminoma or non-seminoma.
Right. And the ones that are resistant to radiation and chemo, are those surgically? Because the doctors told me that the treatment would either be, you know, some kind of chemotherapy, or they'd have to do surgical removal of the other masses, those specifically the ones in my pelvis and my lung. Is that what that would be?
Yeah. So I mean, both seminoma and non-seminoma can go into the lymph system in your abdomen and into your lungs and everything else. Typically, once it's spread significantly, both types would get chemotherapy. And then after chemotherapy, depending on if there's any residual masses, depending on the size of those masses, would kind of necessitate if you needed further surgery after that. The problem in particular with testicular cancer is you can have what's called teratoma, which is actually a form of non-seminoma, but it can show up pretty much any time in the lymph system. And this teratoma really isn't chemosensitive or radiosensitive. And technically itself, it's really not metastatic, so to speak. But the issue is that it can actually transform into other more deadly cancers. So if possible, they like to go in and take any of those residual masses out just to be sure that there is no teratoma in them.
Right. Okay, so I guess which one do I want to hope for? Is there one?
Typically seminomas, you know, it's a little bit difficult. Overall, seminomas are traditionally more treatable. Once the disease spreads into the abdomen, what they do is they break you down into, it's basically a risk assessment of advanced disease, and you're either good risk, intermediate risk, or poor risk. In seminoma, no patient's really considered poor risk. So you can really have a much larger spread of seminoma and still have pretty good outcomes. Where non-seminoma, there is poor risk conditions depending on where it's spread and what your tumor markers are in your blood. I guess overall you'd want to go for seminoma. Both really are pretty treatable even after they've spread.
The question I would ask, the doctors told me this, and you tell me if your information sort of lines up with it. They told me that it is you know, some dip in your testosterone levels. However, most of the time, the testicle that you have left more than compensates for it, and it's sort of like, it sort of picks up the slack. And aside from the fact that the testicle that they removed, it wasn't functioning for a while anyway. That was what they told me about mine. They said, well, so it's not really serving a purpose there. So what would you say about testicular cancer and testosterone levels?
So yeah, the general theory is that you only need one testicle, and that it should be able to maintain enough testosterone production to live a normal, healthy life and a normal sex life and everything else. There is always the possibility, and probably around 10 to 20% of guys, even with the testicle removed, will have low testosterone levels and may be symptomatic. It's something just to keep in mind. There's been recent data showing that if you actually go through chemotherapy, that almost a third of guys, or around a third of guys, do have clinical hypogonadism, or basically low testosterone. So is
that a consequence of the chemo? That it hits their testosterone? Is that what you're saying?
Yeah, it's a consequence of one, having a testicle removed, and then also a direct effect of the chemotherapy on the testicle tissue that's remaining. It just it leads to a low testosterone level. I think the key is to being cognizant that this can occur, and obviously if you start having symptoms, to bring it up to the physician to get checked.
And what are some of the symptoms of low T? Is it like low sex drive and other
It can
things?
be low sex drive, but also, I mean, it could just be excessively being tired for no other apparent reason. It could be symptoms of depression, not able to handle stress very well. There's some mental aspects to it too. Unfortunately, there's been a lot of survivors that we've met that have like these depressive symptoms, and their doctor puts them on an antidepressant that doesn't seem to work, and unfortunately they think that something's wrong with them from a mental aspect, when really it has a physical basis of the low testosterone. So if you start having those kinds of feelings, getting testosterone checked, at least up front, it doesn't seem like a bad idea in my mind.
Some would say you need to get some B vitamins, and they lots of B vitamins. And some people would say, oh yeah, no, you need to start, getting cannabis or cannabis oils. That they're really helpful for fighting against cancers. How much do you actually know much about that stuff? And can you speak to any of that?
Well, yes and no. I mean, I've seen guys do alternative treatments, and only alternative treatments to treat testicular cancer, but I've yet to meet one that's had a successful outcome. For example, let's say you just want to use cannabis oil and it's going to cure your testicular cancer. I've never seen that happen to anyone. Now, if you're using, cannabis to treat your symptoms, say your nausea and vomiting, or lack of appetite, even its anxiety, reducing agent, as well as getting the normal chemotherapy, then I think that's reasonable. But just going on alternative treatment itself, I've never seen a successful outcome. We also hear a lot about antioxidants. While you're on chemotherapy, the job of the chemotherapy is to create oxidative stress and kill the cancer cells. So in theory, taking a whole bunch of antioxidants might be counterproductive to the chemotherapy in general. I think anything in excess probably isn't really advisable. This is one particular cancer where we know that the modern chemotherapies, and not even modern, they're 40 years old now, are extremely successful. And to try to change that, it just doesn't make much sense to me.
Is testicular cancer one of those that gets a lot of funding, or a lot of charity drives, that kind of thing, like in the same way that, say, prostate or breast cancer does?
No, not even close, unfortunately. There isn't much funding at all for testicular cancer. One, not a lot of guys get it. The guys that do get it are young, and they're starting their careers or getting out of college, and suddenly are starting to go into medical debt because of their treatments. so they don't have the resources to really give back, no matter how much they would want to. And for some reason, I'll be quite honest, if you were 14 years old and had testicular cancer, that pulls at people's heartstrings. But if you're 18 or 19 or 22, people just don't seem to care as much. And not saying your close friends and relatives, but in general, so there just isn't much funding whatsoever.
Do you think TC should get more? Do you think it needs it? I know that it has a really high survivability rate, and do you think that this should be getting more support than it currently is?
Yes, I think from a couple different perspectives. I hate comparing cancers, but if you look at pediatric cancer, no one wants to see a sick child, right? And it creates a lot of emotion in individuals. If you look at just one entity for pediatric cancer, like St. Jude's Research Hospital, generates $130,000 or $100,000 in donations for each and every pediatric cancer patient diagnosed in the U.S. each year. Testicular cancer has about the same number of patients as all pediatric cancers put together, right around 9,000 or 10,000 a year. We generate $7 in donations per each guy diagnosed. So $137,000 per patient versus $7 per patient. It really is a huge disparity. You get things like, well, the cure rate's so high, it's not necessary. Well, the problem is that basically 30% of the people coming to us primarily are coming for financial reasons. They need to be able to not have their car repossessed, or they need to be able to pay their insurance in order to get the treatments. And what we do know is that when a guy dies of testicular cancer, on average, that's about 38 years of life lost and $1.3 million in productivity lost. So even the guys that do die, it's a huge impact to society. It's actually, testicular cancer is the most expensive cancer when we lose somebody to it, based on productivity. And beyond that, it's obviously the loss in our hearts that we have when we do lose someone that we know.
Thanks for joining us on today's Fireside Chat. Please leave a comment below.